WHO estimates that more than 13 million annual deaths globally are due to avoidable environmental causes, including climate crisis. With direct consequences of the key determinants of health, climate change is negatively impacting on water quality and food safety. And at the same time, it has an impact on human habitat and shelter. The knock-on effect on the burden of heat, heart and lung disease, stroke and cancer, among others, is evidence from the statistics that the point of non-communicable diseases representing a growing proportion of Africa's disease burden. In the African region, non-communicable diseases are said to overtake communicable diseases, maternal, neonatal, and nutritional conditions all combined together, to become the leading cause of death by 2030. That's a shift in the disease pattern. COVID-19, along with spiraling obesity, diabetes, hypertension rates, compound the challenge, highlighting the urgency of a multi-sectoral response. And I'm happy we have all the people on the table to address this challenge. During the past 2 decades, most public health events have been climate-related, whether they were vector or waterborne, transmitted from animals to humans, or the result of natural disasters. For example, the diarrhea disease are the 3rd leading cause of disease and death in children younger than 5 in Africa, which is a significant proportion of which is preventable through safe drinking water, adequate sanitation, and hygiene. However, 1 in every 3 persons in Africa faces water scarcity. While about 400 million people in sub-Saharan Africa alone lack basic access to drinking safe water. About 45% of all child deaths are also associated with malnutrition, which is known to be linked to diarrhea. Meanwhile, a heating world is seeing mosquitoes spread disease further and faster than ever before, with serious consequences of African countries, which reported 94% of the 290 million cases of malaria recorded globally in 2019. Deaths due to malaria in the African region accounted for 51% of all the cases reported globally. In 2018, African Health and Environment Ministers endorsed the 10-year Libreville Declaration on Health and Environment in Africa, which was signed in 2008. This is a WHO-supported framework aimed at promoting government investing in addressing environmental problems that impact on health, such as air pollution, contaminated water sources, and ecosystem damage. Under the auspices of this declaration, we as WHO in the African region support member states to conduct vulnerability, situation, and needs assessment, and to create health national adaptation plans, which are meant to address the climate challenges. We also support countries to submit national adaptation plans comprising essential public health interventions to the United Nations Framework Convention on Climate Change. We commit ourselves to support Nigeria in this regard. Being part of the solution, looking at Nigeria specifically, in 2021, WHO facilitated the signing of the Nigeria Health Sector Multi-Sectoral Commitment and Public Declaration to Building Climate Resilient and Sustainable Health System, with deadlines prior to COP26 Climate Summit in Glasgow in October 2021. WHO has collaborated with the Federal Ministry of Health and partners to train over 74 experts and climate change health desk officers across the 36+1 states to coordinate whole system climate initiatives at subnational level.